Good morning, students. This is Dr. DK, and I'm a faculty from AIMS New Delhi, and I'm working with live questions of neetpg and also the INI-CET for the past 5 years under this Medico app. So today we'll be discussing about the diverse and fascinating questions of all the 5 years neetpg and also the PYQs and also the INI-CET PYQs. So let's discuss about these in stepwise manner. First, I will give the plan of format. So what's the plan of format is, whatever is the head and neck questions all we kept together in the first part. After discussing the head and neck questions, then we'll be going for the CNS, then we'll be going for thorax, abdomen, and then upper and lower limbs. After completing these, we'll go for histology and also the general embryology parts. So this is what the sequence of questions that was framed, so that we will be confined to the region wise questions and we will complete in a region wise sequence. So this is the part we will be starting for. Okay, so we start with that. And before starting these things, just one thing, the workbook is already given in the description link. So please download this workbook from the description link and we will start that. So we'll be discussing here for the past 5 years questions of both neetpg and INI-CET questions together. And all these questions are framed in such a way that the plan for today's part is, first we will be discussing all the head and neck questions of INI-CET and NEET together. And after that, we will be going for the CNS part. Then it will be going for the thorax, abdomen, and finally the upper and lower limbs. So this is a craniocaudal sequence that we was discussing together, so that we can complete in a region-wise sequence. After completing all the gross part, we will be discussing about the histology and also the general embryology. So this is the plan of action for today entire class. So the link for the workbook is given already in the description. So those who want, you can please download from there. And we'll start these questions from the same sequence what I had said. First, we'll be discussing for the head and neck region. Then we'll be going for the CNS. Then will be the thorax, abdomen, and finally the upper and lower limbs. This is the plan of action. After that, we'll go for the histology and general embryology. Okay, so we'll start the students now. Yeah. Coming to the first question. A fracture in the marked area. There is a marked area that was given at this point. This leads to bleeding of which artery? First of all, you have to identify what is this marked area that was given here. And that marked area is a point of 4 bones we can see. Let's discuss about that point and what are the structures that are present deep in that point. We'll see it. So the pointed structure is actually the pterion. The structure that was given is the pterion. So what are the bones that will be meeting at this pterion part first? It's the frontal bone on the top front, and behind there will be a parietal bone. That's the second bone that is involved. And in the lower part, you can see there is a yellow colored bone here that's called as the sphenoid. In specifically which part of the sphenoid? It is the greater wing of the sphenoid bone. It's the greater wing of the sphenoid bone. And behind the pink colored structure, this is called as the temporal bone. And again, which part of the temporal bone is the squamous part of the temporal bone. So all these 4 bones are meeting at this point, and this point is called as pterion. So pterion is actually the meeting point of these 4 bones, the frontal, parietal, the greater wing of sphenoid, and also the squamous part of the temporal bone. These 4 bones will meeting point is called as the pterion. Now, what is the question they had asked about is, what are the structures that leads to rupture of which artery is ruptured in that pterion damage means. So first we have to understand what are the structures deep into the pterion. Further, the mnemonic to be remembered here is BMAS. Just a minute. BMAS. Here B is for Broca's area, I is for insula, and M is for the middle cerebral vessels. Vessels includes both artery and the vein. Next, A is for anterior division of middle meningeal artery. Middle meningeal artery. So we are discussing about the structures that are present deep to the pterion, and the mnemonic for it is BMAS. B is for Broca's area, I is for insula, M is for middle cerebral vessels, that is both the artery and the vein, and A is for the anterior division of middle meningeal artery. Please remember the division also, because nowadays the trend is going that they're not just asking middle meningeal artery, they are asking whether it is for anterior division or the posterior division. So it's specifically the anterior division of middle meningeal artery that is present due to the pterion. And S is for Sylvian fissure. Sylvian fissure. So these are all the structures that are present deep to the level of pterion. So this is the pterion part, and deep to pterion, the schemas are the structures. So if you go back to the question, what are the options that was given there is middle meningeal artery. Yes, we had already discussed about anterior division of middle meningeal artery that is present. So that might be the answer. And deep temporal artery is not present deep to the pterion. Anterior cerebral artery is also not present. Even internal carotid artery is not present. So if you exclude the three options, the answer is for A, the middle meningeal artery. And once again, I'm saying it is for anterior division of middle meningeal artery, not the posterior division, because now the questions are changing into which division also. It's the anterior division of middle meningeal artery. So the answer for here is A. That's about the first one. Coming to the second question, identify the foramen in the given image. So the given image is of sphenoid bone. So within the sphenoid bone, there are given a marked foramen of this structure. This foramen they had asked for the given arrow. And there are three more foramens are also in the sequence. So let's see about all these foramens and where is the sphenoid bone exactly, and what are the foramens that are present in the sphenoid bone, and what are the contents of each. So we have to identify the foramen, that one. So going back to the next one, that is the major foramina that are present in the skull. So in this, we are discussing about three parts. One is the sphenoid bone foramina. The second one is the foramen lacerum, and the third one is the jugular foramen. Because these three foramens are these three parts of the foramens we are asking regularly. So that's why we are discussing about these three parts. First, come to the sphenoid bone. So whatever is present, this entire part here, this entire part is actually the sphenoid bone. So within the sphenoid bone, you can see here there are three foramens are present in sequence. You can see the first foramen here, and this foramen is called as foramen rotundum. Foramen rotundum. This is the first foramen that is present in case of the base of the skull of the sphenoid bone. Just behind, can you see a oval shaped foramen is present? And that foramen is called as foramen ovale. Foramen ovale. Ovale. And further behind, there is one more small foramen here. This part, this is called as foramen spinosum. Foramen spinosum. So these three foramina are present in the base of the skull with respect to that of sphenoid bone. Now we had seen the foramina. Let's see the contents, because next time they may ask what is the content of this foramina. So you have to be ready with the next questions also that can be asked. So let's discuss about the contents that are present inside this. Inside the foramen rotundum, the now that passes is called as the maxillary nerve. Maxillary nerve. And what are the structures that passing through the second foramen called as foramen ovale is male through ovale. Just remember the mnemonic as male through ovale. M is for mandibular nerve. M is for mandibular nerve. A is for accessory meningeal artery. L is for lesser petrosal nerve, and E is for emissary vein. So these male structures will pass through ovale. You just remember like that, male through ovale. So these are the four structures that are passing through the second foramina of the base of the skull within the sphenoid bone, that is foramen ovale. And the third foramina is called as the foramen spinosum, because the spine of the sphenoid is related there. That's why it is called as foramen spinosum. Now through that foramen spinosum, two structures will be passing. One is the artery called as middle meningeal artery. Just now in the previous questions we had discussed about in the pterion which structure is present, this middle meningeal artery. And this middle meningeal artery is actually passing through foramen spinosum. And one nerve is also present called as nervus spinosus. So two structures are passing through the foramen spinosum. So just to conclude, with respect to the sphenoid bone, there are towards the base of the skull, there are three foramina in a sequence. In a sequence. Just remember the sequence as ROS. ROS foramina. ROS. The first foramina is called as rotundum, second is ovale, and S is for spinosum. And through the foramen rotundum, it's a maxillary nerve, and through the foramen ovale is the male through ovale structures, and through the foramen spinosum, one artery, one nerve. The artery is the middle meningeal artery, and the nerve that is going is nervus spinosus. So these are the foramina at the level of the sphenoid bone. The sphenoid bone is completed. So next come to the next foramina, that is called as the foramen lacerum. What is the question they are asking with respect to foramen lacerum is, it's a foramen lacerum is formed by how many bones? Let's see here. We already said the black colored structure is of sphenoid bone, and this one is called as the occipital bone. This is S I am writing here. There's the sphenoid bone. I'll take the different color. This is the sphenoid bone. Next, O is for the occipital bone, and P is for petrous part of the temporal bone. At the junction of these three, can you see one foramina is present? This foramina is called as foramen lacerum. So first and foremost to be remembered is foramen lacerum is formed by the fusion of how many bones? 3 bones. What are the bone names? This is the fusion of sphenoid bone, occipital bone, and also the petrous part of the temporal bone. Petrous part of the temporal bone. These 3 fused together will form one foramina that is called as foramen lacerum. And through that foramen lacerum, what will be the structures passing is, see, it not actually passes through the entire of the foramen lacerum. It only partly goes through the foramen lacerum. And what are the nerves that are called as? One is deep petrosal nerve. Deep petrosal nerve. And the second one is called as greater petrosal nerve. So deep petrosal nerve carries sympathetic fibers, postganglionic sympathetic fibers, but greater petrosal nerve will carry preganglionic parasympathetic fibers. So there is a difference here. But towards the contents, if you go through the foramen lacerum, it is the deep petrosal nerve and also the greater petrosal. That's the second foramina that we have is. Coming back to the third foramina that is regularly asking, that is called as jugular foramen. That jugular foramen we will be discussing in the next part here in the tongue sensations, because the next question is related with here. The jugular foramen is having 3 compartments. Let's imagine this is a jugular foramen. This jugular foramen. And in this jugular foramen, there are 3 compartments are present. This is the anterior compartment, this is the intermediate compartment, and this is the posterior compartment. Let's imagine that. So within the anterior compartment, the structure that is passing through it is called as inferior petrosal sinus. Inferior petrosal sinus. Whereas in the posterior compartment, we have sigmoid sinus. This sigmoid sinus will have to be drained into the internal jugular vein. Into internal jugular vein, IJV, internal jugular vein. So anterior compartment has a sinus, posterior compartment has a sinus. The anterior compartment sinus is inferior petrosal sinus, and the posterior compartment sinus is the sigmoid sinus, which will be draining into internal jugular vein. Then what about the middle compartment is, middle compartment consists of 3 nerves. One is the 9th nerve. Next is 10th and 11th nerve. 10th and 11th nerve. They are not asked about these middle compartment contents. They are asking a question in specifically that the 9th nerve is enclosed by one dural sheath, whereas 10th and 12th is together is enclosed by another dural sheath. So which of the following nerves has only one dural sheath surrounding it in the level of the jugular foramen? So it is the 9th nerve. So 9th nerve has specific one dural sheath surrounding it, whereas the 10th and 11th together is commonly enclosed by another dural sheath. So there are 2 dural sheaths with the 3 nerves within the middle compartment of jugular foramen. Hope all the 3 types of foramen is clear. The first one we had discussed about the sphenoid bone with the 3 foramens, that is ROS. Foramen rotundum, foramen ovale, and foramen spinosum. In the second part, we had discussed about the lacerum. The foramen lacerum is actually the fusion of 3 bones. and two petrosal nerves will be going, that is deep petrosal and greater petrosal. The third part we have discussed about the jugular foramen, where it is divided into three compartments, where anterior is a sinus, that is inferior pectoral sinus, posterior is also the sinus, that is a sigmoid sinus draining into internal jugular vein. But in the middle compartment, ninth nerve is surrounded by a single dural sheath, whereas 10th and 11th together is enclosed by a common dural sheath. So that's about the conclusion that we had discussed about the base of the skull, foramina. So going back to the question, so identify the foramina that is present here. What is this foramina? I already said what is the mnemonic to be remembered is ROS. Foramen rotundum, foramen ovale, and foramen spinosum. So the marked foramina is of foramen rotundum. So the answer here is for A. So they may be asked, the next time they will not ask only about the identify the foramina. They may ask about what is the content that is passing through the foramina. So it's the maxillary nerve that is passing through that of the foramen rotundum. So hope that everything is clear up to this regarding the foramina that is present. The major foramina that is present towards the base of the skull. Coming to the third now, fracture of jugular canal presents as loss of taste of anterior 2/3 of the tongue, loss of taste of posterior 1/3 of the tongue, loss of general sensations from anterior 2/3, loss of motor sensations from anterior 2/3. So they are connecting the jugular foramina contents and also the tongue. So let's discuss in parallelly. As we already discussed regarding the jugular foramen and the contents here, so let's discuss regarding that of the tongue part. The tongue part is divided into three parts. One is the anterior 2/3 of the tongue, a posterior 1/3 of the tongue, and the posterior most part of the tongue. So the three parts of the tongue are present: anterior 2/3, middle one, posterior 1/3, and also the posterior most part of the tongue. For this, what are the general sensations? What are the taste sensations are being taken for? For the anterior 2/3, the general sensations is taken by lingual branch of mandibular nerve. So I'm keeping as the third branch of fifth nerve, that is a mandibular. So they are taking only general sensations from anterior 2/3. Whereas taste sensations from the anterior 2/3 will be taken by the cauda tympani nerve. And this cauda tympani is actually a branch from facial nerve, that's the seventh nerve. Here is an exception, and the exception is asked many times in the neetpg, the previous neetpgs. What is the exception is, I am already saying that anterior 2/3 of the taste sensations is taken by cauda tympani nerve, but one part it is not taking. What is that is this circumvallate papillae. You can see here, these circumvallate papillae, even though they are present in the anterior 2/3, but the taste sensation of these circumvallate papillae are not taken by cauda tympani. So write down here the exception as cauda tympani. Sorry, exception as circumvallate papillae. Circumvallate papillae. So I'm repeating again, even though circumvallate papillae are present in the anterior 2/3 part of the tongue, it is not taken, the taste sensations are not taken by the cauda tympani. Then what about this part? That we will be discussing in the posterior 1/3 of the tongue. So in the posterior 1/3 of the tongue, the general sensations is taken by the glossopharyngeal nerve. Even the taste is also taken by glossopharyngeal nerve. And the exception which is present in the anterior 2/3 will be continued here with ninth nerve. That is, it also takes taste from circumvallate papillae. It also takes the sensations from circumvallate papillae. Next, coming to the posterior most part of the tongue. The posterior most part of the tongue, general sensations will be taken by 10th nerve, and even the taste sensations are also taken by 10th nerve. Okay, so if you go with that, anterior 2/3 is only difference between the general and the taste. The remaining posterior 1/3 and the posterior most part, it is taken by 9th nerve and 10th nerve respectively for both general sensations and taste sensations. Whereas in anterior 2/3, the general sensations will be taken by lingual nerve, lingual branch of mandibular nerve, whereas the taste sensations will be taken by the cauda tympani, except there's a stress point to be remembered, except the circumvallate papillae. Then what about the taste sensations from the circumvallate papillae? It is taken by the 9th nerve. So going back to the question, so if there is a fracture of jugular canal, So we already said that the jugular canal is actually passing through with 9th, 10th and 11th nerves. So if there is a fracture of jugular canal, there will be a damage of these three nerves only, 9th, 10th and 11th. And 9th, 10th are supplying only for posterior 1/3 and posterior most part of the tongue. There is no relation with anterior 2/3 of the tongue. So let's see the options. Loss of taste from the anterior 2/3 of the tongue. Anterior 2/3 taste is taken by chorda tympani, which is a facial nerve. So it is not related to the jugular foramen. So we are eliminating it. Loss of taste sensations from posterior 1/3 of the tongue. So the posterior 1/3 of the tongue, general sensations and also the taste sensations are actually carried by the glossopharyngeal nerve, that is the 9th nerve. And this 9th nerve is also the content of jugular canal. So this might be the probable answer. Next, coming to the C option, loss of general sensations from anterior 2/3. The general sensations from anterior 2/3 is related with the lingual branch of the mandibular nerve, and it is not the content of jugular foramen, so we are excluding it. And loss of motor sensations from anterior 2/3 of the tongue. There is no loss of motor sensations, motor paralysis will be there, and it is due to the damage of hypoglossal nerve. It is not specifically for anterior 2/3, it for the entire tongue will be the damage. So this is also excluded. So if you come to the options, the loss of taste for the posterior 1/3 of the tongue is lost because of the damage of 9th nerve. So the answer for third one is B. Okay, that's about the first three questions. Next, go with the fourth question. Which of the following marked nerves in the given image are associated with ocular movements? So they are giving the cranial fossa and the cranial nerves. See, cranial nerves, they are asking in such a way that there are two options. Whether they are showing the cranial fossa and ask that which cranial nerve is this one. The second thing, they can also ask the same cranial nerves with respect to brainstem. Okay, the cranial nerves identification, you have to be thorough with both parts. Whether it is showing with the cranial fossa, identify the cranial nerves. Whether with respect to the brainstem, you have to identify the cranial nerves. In both parts we are discussing. First, we will be discussing about the cranial nerves that are related with the cranial fossa. See, the cranial nerves are given as 1, 2, 3, up to 12. It is based upon the cranial to caudal arrangement. So whatever is the nerve cranial most is present, that is given as number 1. And whatever the nerve which is present at the caudal most, then that is given as number 12. So don't just think that is arbitrarily given. There is some concept behind it, and the numbers are given from 1 to 12 is based upon whether the arrangement of the nuclei are from cranial to caudal. Okay, so which is the cranial most now here? We will discuss that in the image of workbook. So the cranial nerves with respect to the base of the skull. So in this is the cranial end, and this will be the caudal end. So with respect, I had already said the cranial nerves are given the numbering as 1 to 12 sequence based upon whether which is the cranial most that has the first cranial nerve. So here the cranial most structure that is present, the cranial nerve here is this one, and this is number 1, that is olfactory nerve. And further behind, this is the second one that is having, that's called as the optic nerve, the second cranial nerve. Next, come to the set of both divisions, both superior and inferior divisions of third cranial. And further behind, you have to observe two things. This is the thinnest cranial nerve, which is fourth nerve, and this is the thickest cranial nerve, which is fifth nerve. Both has to be in adjacent ways, are adjacently present. So this is the thinnest cranial nerve. You can see of all the cranial nerves that has the thinnest part. I am zooming the image. You can see here. This cranial nerve, this part is the thinnest part. So out of all the cranial nerves, this is the thinnest cranial nerve, and very adjacently or very below it, there is a thickest cranial nerve that is present. That is the cranial number 5. So that's the sequence of 1 to 5 in the sequence. The most cranial nerve is olfactory, then the optic, and the third cranial is oculomotor, fourth is trochlear, and fifth is the trigeminal. Sir, how to identify fourth and fifth? I am saying that there has to be the thinnest and the thickest has to be in adjacent sides. The thinnest cranial nerve is the fourth nerve, and the thickest cranial nerve is fifth nerve. Both are side by side. Next, if you see this one, this nerve, which is almost near to the midline but caudal to that of the fifth nerve, and this nerve is called as the sixth nerve, which is called as the abducent nerve that will supply the extraocular muscles. Then this part, which is going through internal acoustic meatus, two nerves will be going there, both the seventh nerve and also the eighth nerve. That is the facial and vestibulocochlear nerve. And next is the jugular canal. Just now we had discussed jugular canal is for three cranial nerves. What are those cranial nerves? They are 9th, 10th, and 11th. Once again repeating, which is the cranial nerve which is surrounded by a single dural sheath? It is the 9th nerve. And 10th and 11th are enclosed common dural sheath through the jugular foramen. And this is the last cranial nerve that is present, that is the 12th cranial. So this is how to identify the cranial to caudal sequence, that is 1 to 12 sequence. And in that, how to identify 4th and 5th. Usually students will confuse the level of 4th and 5th, and I am saying that 4th is the thinnest and 5th is the thickest, and they are side by side. Now, what is the question they had asked is, what are the structure, what are the nerves that are carrying that supplies for extraocular muscles? Is, see, extraocular muscles has a mnemonic that SO4, LR6 and RO3. That means the 4th cranial nerve will supply for superior oblique, 6th cranial nerve will supply for lateral rectus, and the 3rd cranial nerve will supply for the remaining ocular muscles. So SO4, LR6, RO3 is a mnemonic for the extraocular muscles. So here we have to identify, the question is asked about the extraocular muscles supplying nerves. So that is nothing but 4th, 6th and the 3rd one, right? So let's go back to the question, what they had given. Look at the image. They had pointed A. What is A? Just now we had discussed. See, this is the second one. This is the first one, it is present. This is the second one is present. So it's a second now. A is the second now. And if you see the B, B is the next immediately downwards present. So it is the third now. And C is the thinnest cranial nerve and fifth is the thickest cranial nerve. Both are side by side. So thinnest cranial nerve is fourth nerve and thickest cranial nerve is fifth nerve. So going back to the mnemonic, SO4, LR6 and RO3. So only 4, 6, 3 are the one which are supplying for ocular movements. So in this, third and fourth is given. So third cranial nerve and fourth cranial nerve is given. 6 is not given in options. So B and C are the one which are supplying for extraocular muscles. So if you go for the options, B and C. So here the answer is for B. So B and C are the one which are actually supplying. The B is nothing but the third nerve and C is the fourth nerve which are supplying for extraocular. Even though sixth is also supplying, but the given marked image is not given for the sixth nerve. So that's why we are not talking about sixth nerve. The marked image is showing only the third and the fourth cranial nerves, and that is the option number B. B and C are the third and fourth cranial nerves. So option number B is the right answer.